co-director of the Clinical Chemistry Laboratory at Children's Mercy Hospital.
Okay, so I have 10 minutes. Thank you so much for having me talk today. I really enjoy letting people know about the field of laboratory medicine. And just before I get started, I'm going to give a little background of how I got to where I am today. So I did my undergraduate degree in genetics at KU, Rock Chalk. And then I did a Ph.D. in genetics and molecular biology at Emory University. And then I moved to WashU in St. Louis and did a postdoc in cell biology. So kind of hopping around a little bit. So as I'm doing this postdoc, I have a mouse project, and it's year 4. I'm trying to decide, what am I going to do? Because all you hear as a graduate student, as a postdoc, academics, you have to go be a professor, you have to have a lab. And I'm trying to decide, do I want to do that? Is that really where my interests lie? Will that make me happy? I didn't know. And so one of the techs in the lab that I worked with had a friend who was doing a postdoc at WashU. And she would come by the lab and talk, and I'd ask her, so what are you doing? She's, oh, I'm doing a clinical chemistry postdoc in laboratory medicine. I'm like, what is that? I've never heard of that. I think I remember on my way to the radiator, I saw a sign on the wall that said lab medicine. Had no idea what that department was, what goes on there. And so as she told me more about it, I'm like, that sounds like something I'm very interested in. Sounds exactly up my alley. So what exactly is laboratory medicine? So here's the textbook definition. So it's applying biochemistry, molecular biology, and hematology to diagnosis, prognosis, and monitoring of human disease. And so at Children's Mercy, I'm in the Department of Pathology and Laboratory Medicine. So when you hear pathology, usually what you think of is what's termed anatomic pathology, which is looking at slides, doing autopsies, stuff like that. So there's another part of pathology that's clinical pathology, which is basically the same thing as laboratory medicine. So there's a statistic that a lot of clinical chemists like to use, and it states that 80% of medical decisions are made based on laboratory data. So the laboratory and the information that we can give is very, very important to clinicians and diagnosis and stuff like that. It's also very good because if you're working in the laboratory and 80% of all these decisions are being made with your data, you have the opportunity to collaborate with almost everybody in the hospital. So that's good because you can make lots of connections. Okay, so laboratory medicine is kind of the umbrella. There are different subspecialties. So clinical chemistry is my specialty. There's also clinical microbiology, clinical immunology, and also molecular diagnostics. And right now, molecular is exploding with all the next-gen sequencing techniques. And I know at Children's Mercy, we're sequencing whole genomes on a clinical basis. So it's just amazing all this stuff that's going on with molecular. Of course, I'm more biased towards clinical chemistry. That's very, very exciting. So what exactly is clinical chemistry? So traditionally, we look at blood, urine, other body fluids. You'd be amazing how many different types of body fluids there are. I mean, you think CSF, pleural fluid, the lab gets a call. We aspirated some joint fluid. Can you tell me what the protein level is? Sure, we'll give it a try. And so we use biochemical and immunoassay methods. So that's the traditional chemistry laboratory profile. Now, there's all kinds of new technologies involving molecular techniques and especially mass spec. If you have mass spec experience, you are highly sought after because all kinds of assays are moving to the mass spec platform where you can have a very small sample volume and assay 40 different things. Especially in pediatrics where the patients are really small, that's a really good thing. But it's a hot, hot area. So if you have mass spec experience, that's excellent. I don't. So anyway, if you're a clinical chemist, where do you work? Are you limited to just working in a hospital? No, not at all. So there are, most of the jobs, most of us work in clinical laboratories. So you could be at an academic medical center like Children's Mercy or KU. You could be at a reference laboratory, like there's a Quest out in Lenexa, or clinical research lab in Lenexa also, or your lab in DeSoto. Or you can work at a community hospital like Olathe Medical Center or something like that. There's also opportunities in industry. You could work for the in vitro diagnostics companies that are making the analyzers and coming up with the test platforms and allowing the people in the clinical labs to do their jobs. You can also work in the pharmaceutical industry. So there are lots of different opportunities in this field. So what do I do all day? That's always the question. That's kind of what I was asking my friend of a friend. You know, what does a clinical chemist do? Well, the great thing about this job is you never know what you're going to do. You wear many hats and you go to work in the morning and you just never know what's going to happen that day. Sometimes that's bad if you have to have a deadline you need to work on, but other times it just makes things exciting. So of course the main part of my job is a clinical aspect. So I oversee operation of the laboratory. We need to make sure that all the analyzers are operating properly and giving correct results to the clinicians. We also act as consultants to clinicians. So they'll call and say, I got this result on my patient and it doesn't make sense with their condition. The next thing is, what's wrong with your analyzer? That's what they always say. But then we can help them troubleshoot, like, okay, well, this is going on with your patient, so maybe that explains this result. Or sometimes it is my analyzer. So that's the main portion of what I do every day. There's also a research portion. You know, even though I didn't want to have my own research lab, I still enjoy doing research. And there's still a lot of opportunity to do translational research. And like I said, with all the different departments in the hospital, you know, I've collaborated with cardiology, a lot of collaborations with endocrinology, other collaborations with the emergency department, you know, and that's opportunities to do research projects and get publications. There's also biomarker discovery. You know, I know people that are working on finding whatever analyte it is that will tell you that this person is having a stroke. Or if someone could identify an analyte that will say that's their pancreatic cancer, because that's a very hard cancer to diagnose. You know, so discovering biomarkers like that is an opportunity for research. There's also a teaching aspect to this position. In pathology, we can teach residents and medical students that rotate through the department. There are also opportunities to teach medical technology students, like KU has a med tech program. Now, if you work in industry, you have the opportunity to develop new tests, to put on the analyzers, and also sponsor clinical trials. So there's lots of different things you can do with this skill set, and lots of different places you can do it. So what do you need to do to become a person in laboratory medicine? So you need a Ph.D. in either biological, chemical, or some type of molecular science. You know, my degree is in genetics, but I had enough chemistry hours that I could satisfy the requirements. And so then there are postdoctoral fellowships that you can do that are 2 years that are a combination of didactics, where I had never taken a physiology class. And so if I'm going to help someone interpret kidney function testing, I really need to understand how the kidney works and what happens when the kidney isn't working properly. You learn technical aspects of how all the different assays work on the different platforms. You get practice answering calls from clinicians, and then you also do research. And this varies depending on which program you're in. So if you're going to be a director of a clinical laboratory, regulations require that you be board certified. So there are multiple different boards where you can get certification. I'm certified by the American Board of Clinical Chemistry, but microbiology, genomics, or genetics, and immunology each have their own boards. And so, okay, I can slow down. So I didn't make copies of this, but I emailed it to the organizers, so if anyone wants more information, they can access this. So the organization that most clinical chemists belong to is the American Association for Clinical Chemistry. I'm actually leaving tomorrow to go to the big annual meeting. And their website has a lot of different information if you're interested in the field and what type of things chemists do. If you're interested in learning more about the different postdoctoral fellowships for clinical chemistry, if you look on the COMAC website, there are 30 accredited programs across the country, and you can see what the requirements are and get contact information if that's something you're interested in. Another thing, if you're interested in microbiology, definitely check out the ASM website because they have information about their fellowship programs. And then genetics and genomics, you can check out the ABMGG website to get more information about that. Another thing, if you are interested in a certain area and you want to meet more people and learn more about it, look and see where their annual meetings are, because I have friends that the AACC was in Chicago one year and they lived close to Chicago, so they just went and, started going to some of the mixers and on the expo floor and just were meeting people and saying, hey, I'm interested in clinical chemistry, can you give me information about it? So all these societies have meetings, annual meetings where you can go and get more information. So, thank you.